Thank you for joining us today. Good afternoon. I'd like to introduce you to Dr. Ryann Christensen. Dr. Ryann Christensen is a highly skilled and compassionate orthodontist creating confidence-filled smiles in her hometown of Fresno, California. She studied at the University of California, Los Angeles, where she earned a Master of Science, a Doctorate of Dental Surgery, and a certificate in orthodontics. Driven by a commitment to excellence, she participates in continuing education to stay at the forefront of orthodontic technology and practices. She's a proud member of the American Association of Orthodontics, American Dental Association, California Dental Association, and the Fresno Madera Dental Society. Today, Dr. Christensen is going to be discussing the synergy of dental monitoring and braces to maximize treatment effectiveness. If you have any questions for Dr. Christensen during the presentation, please don't hesitate to use the chat feature to ask your questions. We will be answering all the questions at the end of the webinar. So without further ado, let me turn it over to Dr. Christensen.
All right, thank you so much for that introduction. Good morning, and to some, good afternoon to others. All right, so today I am going to be talking about the synergy of dental monitoring and braces to maximize treatment effectiveness. I started dental monitoring almost about a year ago, and I do use dental monitoring for pretty much all of my cases, whether they be braces, clear aligners, phase 1 comprehensive, reevals, and retention. But today we will be focusing on how dental monitoring and braces work together. So today you'll be learning about my practice and how dental monitoring maximizes braces treatment effectiveness. Also, just an overview of how dental monitoring works and my treatment approaches using dental monitoring in a few of my braces cases. So a little bit about me. I was born and raised in California, in Fresno, California. I went to UCLA for dental school and residency and moved back to Fresno immediately after finishing residency. I married my high school sweetheart, and we have 2 wonderful kids, ages 2 and 4. And I do enjoy being outside and running. Nowadays, my running looks a little bit more like running after my crazy kids and not so much running alone, but it's been fun. And living in Fresno, we're lucky to have a lot of farms where we can go outside, utilize them and pick our own produce. So we try to get outside and enjoy the warm California weather, and also go to the beach as often as we can. So a little bit about my practice. I worked at a private practice and a few DSOs while finishing residency for about 3 years, and I was just waiting for that opportunity to take over to purchase my own office. I bought an existing practice back in 2020, and the office has 2 locations. The main location is Fresno. It is a slightly smaller office with 3 open bay chairs and 1 consultation room. I do have a satellite office about 40 minutes away in a more rural community. It's a pretty small office with 2 open bay chairs and 1 consult room. And I have a team of 7 full-time members as well as 2 part-time. And my office manager is also my husband. So he does everything that I can't do or that I don't want to do. So I try to focus on patient care, and he more or less does everything else, including being the comedic relief for the office. And recently, I just purchased what I call a very expensive piece of dirt, where we're building a new office, which should be completed in a little bit less than 2 years. And so you can see from the photos, we do try to keep the office, the team, keep the vibe fun and friendly. We do see a lot of young kiddos for phase 1 treatment at our office. So we really try to bring out the fun and the again, comedic relief with my husband doing some wacky things in the office. So it's a really fun time day in and day out at our office. So why dental monitoring? So I'll go over the issues that I've been having, or that I did have, what I call pre-dental monitoring days. Every year, or pretty much consistently, constantly throughout the year, I do look at the office, the things, the woes, the problems, the things that are going well, and constantly try to change things to improve. So as you can see here, here are the few things that I was having issues with last year right around this time. So it's a good problem to have, but I did have a growing number of patients. Year over year, I was growing about 19% since I took over the office. And that also means that the clinical chairs have been overbooked. And so I was, the days were long, we were missing lunches, we were leaving the office after 5. And so things were just getting to a point where I had to figure out a solution. Throughout that time, since 2020, I had been looking to move the office to a bigger space, but that just wasn't happening, and obviously doesn't happen quickly. So I needed a solution that I was able to bring on more immediate than that. Also, I use a lot of appliances where they require check appointments. So the Hyrax checks to see if expansion was sufficient, or Carrier checks to see if the class 1 was achieved. Also, we do a lot of reevals since we do see a lot of younger kiddos. And so the kids are coming in just to see if they're ready for the comprehensive treatment. So a lot of our appointments were really just me looking in the mouth, not really having to do anything aside from that. Another thing is emergency visits just bogging down our schedule. I'm sure everyone experiences this when you schedule an appointment for a patient to come in for a normal adjustment, and they have a broken bracket or 3 broken brackets, and it takes a lot more time than what you were expecting. And so that delays the next patient to be seen. So I was struggling with that. Also, poor oral hygiene. That was one of the things in 2023 that I really wanted to get a handle on. I wanted to find a solution. I hate at the end of treatment when everything looks beautiful. I have a perfect bite, a perfect smile, but then the patient has white spot lesions from not brushing well during treatment. And as much as I can remind them through their appointments to brush better, it just didn't seem like enough. So I wanted to make a change in that regard as well. And last but not least, too much after hour doctor time. I'm a young mom, and I wanted to spend more time with my family after they're done with school and I'm done with work. And so a lot of the times I was pushing my homework, I guess you could call it, to after my kiddos went to bed, but that meant that I was staying up very late a lot of nights. And so I just wanted more flexibility. I wanted to be able to do treatment planning and clin checks during my office hours, somehow figure out a way to do that. So those were really my struggles at the beginning of 2023, right around this time. And so really my firsthand experience with dental monitoring wasn't through a rep or through AAO. It was actually through my nephew that lives in Portland. He is a clear aligner patient up there. And when they came down for Easter last year at the end of April, my sister-in-law showed me dental monitoring. She showed me the app, and she just thought it was the coolest thing. She showed me the before and after photos that they are easily able to look at. And again, they just thought it was the coolest thing. So I was able to see firsthand what dental monitoring was and how it was contributing to his patient care, and just how happy his mom was that she was able to see the progress. She was able to have direct communication with the orthodontist. And so that is really what sparked my interest in dental monitoring. A few weeks later, I went to AAO, and I was really my intention was actually to look at something else, bringing on like a indirect bonding system. That was going to be my big change for 2023, as I thought. But dental monitoring did catch my eye there. And so I went to their booth and I looked at what they had to offer, all the doctor behind the scenes, so things that I didn't see from the patient side, but all the AI technology that they have. I also went and looked at a competitor's product to compare pros and cons of both. And I just felt like dental monitoring had so much more AI technology behind their product that it was really a solution to a lot of the hurdles that I was facing. I felt like with a competitor company, with their AI not being as robust, that I would be putting on my plate a lot more work. So I would be adding to my plate by bringing that on and having to check the scans myself, versus dental monitoring with their AI technology. They did a lot of the heavy lifting themselves, and I would just be alerted, or my team would be alerted of the concerns, and then my team would be able to sift through the problems and give me the things that I needed to address, while they were able to address a lot on their own. So I felt like it was actually a perfect solution for my office. So just an overview of dental monitoring by the numbers. So at this time, they serve over 8,000 doctors. They're monitoring well over 1.7 million patients. So they have a ton of a ton of robust information that gets behind their AI technology to continuously make it better and better. With their technology, they have over 290 patents, 137 observations, meaning that the AI will pick up those 137 points and will alert the doctor and team if there is anything out of the ordinary or anything that we need to observe. And like I mentioned, it's compatible for all treatment, all appliances, all treatment phases. So it's really all encompassing. They do have an international presence. So they're all over North America, Europe, and Asia, over 50 countries. And they are compliant with HIPAA, which is also very important with dealing with patient information. And so here is the new patient journey using dental monitoring. So dental monitoring even has a feature where you can use, as an orthodontist, you can use dental monitoring to even get patients in the door. So future patients, they can use dental monitoring. You can embed it into your website, where they can take photos through your website, and then you can get that information and reach out to them to let them know if they are ready for treatment. So it is a very nice first introduction that they have to your office. And with those photos, dental monitoring utilizes their AI technology to give you some of that information right off the bat as well. So it's pretty efficient and effective for you to use that feature. Also, while the patients are in treatment, so at their first appointment, when they're in the chair ready to get started, you deliver dental monitoring to them, show them how to scan, how to use the app. And so they just hit the ground running. And most of the time, the patients will be scanning weekly. And so from the start, you'll be able to closely monitor your patients. So they're getting the more frequent visits, out of office visits with your office. So they are consistently being monitored, closely monitored. And with those photos that dental monitoring has them take, it goes through their AI analysis. And like I mentioned, 137 points where they're looking at. And then you are able to get that information of any alerts that come up, whether it be oral hygiene related, broken brackets, broken attachments, if aligners aren't fitting, if retainers aren't fitting. So pretty much anything under the sun that you would need to know or be interested as far as their treatment goes. You'll be receiving that information and communication. I'll talk about it a little bit more, but there's also even goals that you could set. So if you're waiting for a patient to get to class 1, if you gave them rubber bands, you'll also get that information once they achieve whatever goals that you set for them. And so also with all of that information, Dental Monitoring has a product called Dental Monitoring Insights, where you're able to gather all the information from your patients, your practice, and get the statistics. So how many broken brackets you had that month, what teeth they're on, and compare it even to national averages. So you're able to talk to your team about the things that you see, if there's trends that are going on to help improve the patient experience, the office experience, and just make your office hum a little bit better. So like I mentioned, I went to AAO, and after visiting their booth every single day, I decided to join. The day that I was leaving, I made that phone call in the airport and let them know that I was ready to get going with dental monitoring. So we started the implementation process at the end of May, and we had a few team members from dental monitoring come into our office, speak about the process, the onboarding, what dental monitoring would look like as it pertained to the appointments, the patients. So really gave a good overview for my team of the benefits and how this would change the office and the protocols and what have you. So we, as an office, onboarded I decided to onboard all of my phase 1 patients, even those at the end of treatment, because I knew that I wanted to follow them during their retention as well as likely phase 2. I onboarded, of course, all new patients and current patients that had over 6 months left of treatment. So we just went full force. We started that process. And as always, with onboarding new technology, new systems within the office, there's always challenges. So with the initial challenges, the initial challenge was, as you're bringing those patients to into your office and introducing dental monitoring, it does take a few more minutes of your time to have them do the scan, have them watch the video of how to do the scan. And so we really had to work together as a team to make sure that we were making those appointments as efficient as possible. And luckily with that onboarding, so if you start like I did and onboard all of your patients, it'll take about 6 weeks of the extra few minutes per patient. But luckily there was that light at the end of the tunnel. And so we really felt the relief and even a lot of decreased appointments even right after that 6-week mark. Similarly, there's always a concern about the team response with bringing on any new technology. Luckily, the team had a really positive response with dental monitoring. They saw the vision that I had of decreasing those redundant appointments that didn't necessarily have to be in the office. And they saw the benefits that it would bring to the patients as far as the constant monitoring. So the team was pretty they responded pretty well with that onboarding process. Towards the end of that 6-week onboarding, I would say week 4, 5, and 6, they felt it a little bit, but I assured them that towards the end of that, I promise that that part of it will be done. And so again, we did find pretty immediate relief after those 6 weeks. And actually, after the 6 weeks, this was during summer. So it was essentially all through June and mid-July that we were onboarding all of our patients. And literally at the end of July, my schedule felt so much more empty. And it was the summer. So I was really concerned that my front office team member wasn't contacting those patients that needed appointments, getting those patients in. So I was really concerned that we weren't getting the patients in that were supposed to be coming in. But the reality is that the patients that we weren't seeing were those that no longer needed those check appointments, or patients that were in NiTi wires. I decided to see them instead of having them come in every 6 weeks to first just do a retie and then see them back 6 weeks later to put in their new wire. What I had decided at the beginning is any patients that I was placing new NiTi wires, instead of seeing them 6 and 6 weeks, I just waited to see them back in 10 weeks where I would change out their wire then. So we were shaving off a little bit of time per arch wire, but we were seeing them one less appointment for each wire. So that really dropped down the number of patients we were seeing pretty much immediately, while we were still consistently monitoring their progress, making sure that we were getting the movements that we wanted to see in those cases. So there's quite a few benefits that I saw for the implementation right off the bat. So as far as the practice goes, I felt that it was a huge practice differentiator. In my area, I was the first office to bring on dental monitoring. And so just like any new technology, any way that you can make your practice different from another office is a positive. And so my treatment coordinator would talk about dental monitoring to the exam patients to let them know how this would benefit their treatment. And so I felt like that was a huge reason why patients were choosing our office. So we felt an uptick in patients that were choosing our office, especially the ones that were coming in for second opinions or third opinions. I felt that that was a huge difference. We also, because we were the only office at the time implementing dental monitoring, that was a reason to go out to all the general dental offices in the area. So we did a huge push at that time where we went to all the different offices, let them know of this great technology and how it would improve patient care, improve oral hygiene for their patients. And the cool thing about dental monitoring is the dentist can also have access to the patient's chart. And so they can see how the progress is going and have communication with me regarding their own patients. So it was a great way to go to new offices to let them know that this is something that we're offering to patients, and not many other offices were doing that. As far as the patients go, the patients, I feel like, benefit greatly from dental monitoring. They are getting constant eyes on their treatment. So if there's any concerns that happen, of course, bracket breakage, arch wire disengagement, those are huge things that if we catch them early, we're able to fix those things immediately. We give them a call. They're able to come in that week to rebond the bracket, to re-engage the wire so that they are not missing any time. The last thing that I want are for patients to, at the beginning of their treatment, when a tooth is very rotated, to have that bracket break and not even be aware of that for the whole 6 weeks that I wasn't seeing them, and them come back and we lost all that time. We might have to drop down and wire. And so it just really sets back the patient, as well as it just takes a lot longer for that appointment to rebond that bracket when we weren't expecting to do that. So then it pushes the next patient that we're seeing. We might be late seeing that patient. So it really helps out the patient care. Also, what we found, which was, I would say, relatively unexpected, is that the patients, especially the tweens or the teens, are having a lot more direct communication with the office. For some reason, with the app, they feel like they are able to have a lot more communication with myself or with our team. Even with the AI automatic responses that they get for poor oral hygiene, the AI may send a message saying, just remember to brush a little bit better around your gums. They respond with thank you. Or if they are going to miss a scan, some will respond with, I can't do my scan today, but I promise that I'll do it tomorrow. Or even questions about their treatment, how long they have left for treatment, or I forgot, I don't know how to wear my rubber bands. Can you show me? So then we'll send them an annotated photo of where they're supposed to wear their rubber bands. So that's been really cool to have more direct hands-on communication with the patients. I feel that they're a lot more involved in their treatment instead of just coming to their appointments every 6 weeks. Also with the team, so it minimizes in-office appointments because we're able to take off those expander check appointments, the Carrier check appointments, even some retainer appointments and reevals for them. So it makes their day go a whole lot more smooth. And also the team knows exactly what the patient needs for their upcoming appointment. So we know when the patient has a broken bracket, so we can add on another 5 minutes to their appointment to accommodate that. Or we can see that they are that the wire that they have in maybe a 14 night high and it's well engaged, all the rotations are done, we automatically know that we're moving up in wire. So it makes each appointment very quick and easy, and we know exactly what the patient needs before they even come in. And it also gives us as a team a good reference when discussing oral hygiene. So the first thing that my team does when the patient sits in their chair is they pull up their dental monitoring chart, and they show them, they go over if they got like all green lights with oral hygiene, we give them a high five. We tell them, good job, like you guys, you're doing great. Oral hygiene is looking wonderful. Or if the patient isn't doing so great with their oral hygiene, instead of just seeing the patient every 6 weeks and just saying, oh, it looks like you need to brush better, or go ahead and brush right now, it's not great, we have a history. So we pull it up, we look at what their oral hygiene is today, and we look at the past 6 to 10 weeks and how it's been going. And so if it hasn't been going so well, what we say is, it looks like you've been having a more difficult time. You've gotten 4 reds out of the past 6 weeks. Let me pull up where you've been missing, if it's more consistent. You've always been missing your right side. With a right-handed patient, it's more difficult to brush there. So let me show you how to get there. So it's just an easier talking point as far as if you have anything like hard to say or negative that they're not doing great with oral hygiene, you could kind of pull up and have a talking point versus just saying that today you did bad with brushing. So it's been a little bit easier to talk with patients and even parents, showing them the photos, and parents even if dental monitoring is on the patient's phone, we always have the parent also have the dental monitoring app on their phone. So they are also seeing all of the texts that we are sending the patient, all of the annotated photos. And so they're getting a good idea about what's going on with the patient's treatment. As far as the doctor goes, so similar to the team, it lightens my day. It makes my day go a little bit smoother, and I'm therefore able to work on more things other than direct patient care. So I'm working on my clin checks, I'm working on treatment plans. So I'm trying to do as much as I can during my day so that I have less things to bring home at night. So it's been a huge relief on my plate, a lot less on my plate. We even have been able to drop down. So pre-dental monitoring, I was seeing patients 4 days a week, 7 hours a day. Now with dental monitoring, we're still open those 4 days, but I am able to block out a good 6-7 hours within the week. So usually I block out like 3 hours or 4 hours at a time where I am working on the treatment plans. I'm working on ClinChecks, and my team is still here. And so they're working on all the other things that they need to work on, like ordering, calling the patients, working on the scheduling the patients. One team member is in charge of dental monitoring, and so they're able to go through that. So we're able to have a lot more downtime while our practice is still continuing to grow. So we no longer have that crazy day. We actually have a few hours blocked out per week where we get to catch up on all the things that we need to do. So it's been a huge help in my office. So these are a few of the specific observations that I've seen, which I touched upon a few. So I'll speed through those. But like I mentioned, a decreased number of appointments, especially with clear aligners and appliances. So like I mentioned with the beginning first few appointments with patients in NITI, I have felt comfortable with pushing out their appointments to 10 weeks instead of 6 weeks. And so instead of seeing them 6 appointments to progress through my NITI sequence, I now see them 3 appointments. So for every patient, braces patient, we've been able to cut down from 6 appointments to 3 appointments, with still seeing them as much, or I mean more. We're able to see their scan, monitor them weekly. So we have eyes on their treatment, even a lot closer monitoring than before, but they're in my office a lot less, which is great. And like I mentioned, I already touched upon the appliances. I also mentioned the sooner a broken bracket and disengaged wire repairs. That's a huge one. What happens when a patient breaks a bracket pre-dental monitoring is who knows how long it's been there. We backslide in their progress with their treatment. And even at the end of treatment, when patients are in stainless steel, you schedule them for their debond, and then they come back that day. They're so excited to get their braces off, and a bracket has broken, that tooth has rotated, and you have to let them know that they can't get their braces off because they had a broken bracket and they weren't aware of it, apparently. And so you have to go back down, place them in a NITI, and let them know you don't know when they'll get their braces off because we got to get that tooth perfect. So now with dental monitoring, we don't have those concerns. We know exactly what's going on with our patients before they come in, and we can pretty much guarantee that the patients that are coming in for their braces off are in fact ready to get their braces off. I see a better compliance with clear aligners as well as appliances, because we have that direct, weekly conversation, weekly checkup with them. And so specifically talking about appliances like Carrier's, I have my team reach out every few weeks to ask them how many hours a day and how many days per week they're wearing their elastics, if there's any concerns, if they need more rubber bands sent to them. And so we just have a lot more engagement. So they've been more compliant with their appliances with the weekly scanning. We also have more direct communications with the patients, which I mentioned. That's a huge plus. I think they're just a lot more involved with their care, patients and parents, than just their normal appointments before we had dental monitoring. Also, better oral hygiene compliance. So with their weekly scans, the AI will look at the levels of plaque, and will give them feedback with that. So especially if it's a kiddo, we have programmed the AI for dental monitoring to be pretty consistent with sending reminders of, better brushing. And so they're getting those automated messages if they get a red with their oral hygiene. And I'll show you what that means in a second. The AI will automatically send, DentalMonitoring will automatically send them a message, which as an office you can change the messages to fit your office. So I let DentalMonitoring know at the beginning, I'm a very friendly office. I don't want the messages to sound rude or mean or anything. And so mine are very like positive and upbeat, like you could do it and what have you. So they will get those messages just right off the bat. And we will get alerted if they do get a poor score in oral hygiene. And so my team member is trained to send any additional messages that they see fit. So let's say a patient is consistently getting a poor score, going in, sending them an annotated photo of like, it looks like you're missing this area. Let's work on that. Let's see how you do next time. And so we're just getting a lot more compliance with oral hygiene. And you'll see in some of my patients where their oral hygiene improves over time. Also, lastly, data-driven decisions. So DentalMonitoring has a software, part of their software is what's called DentalMonitoring Insights, where it takes all the data from your practice and compiles it for you. So you can see trends, you can see broken brackets, when those are happening, what teeth they're happening on. And so if you're seeing a trend with that, you can talk to your team about how to fix that. So let's say you'll see in my cases where there is definitely a trend. So I'll save that for later, but you're able to, instead of absolutely not having, before DentalMonitoring, I had no idea how many broken brackets we were having. I didn't have an idea of which teeth were being affected and even wire disengagements. And now I'm able to see exactly what issues we're having. And so I can come up with a solution for that. And so I'll talk a little bit more about those last 3 bullet points right now. And those first 3 bullet points will be in more of the cases. So here, as I was putting this together, the slides together, I just went on my DentalMonitoring dashboard and just took a screenshot of the communication that I had that day. And so you can see here, there were 3 patients that had messaged within a few days. And so Mr. Lucas, so this was all during break, their spring break. And so Lucas just had mentioned that he forgot his new set of aligners while he's been out of town. So he wanted to move his scan back a few days. And so that just shows like the high engagement that patients have with their scans with DentalMonitoring, that they're going out of their way to like text us that they're going to be a few days late for their changing out their trays and for their scan. Also, Darby, she'll be out of town, so she'll do her scan this Saturday. So again, just these patients are messaging us, having a little bit more involvement with their treatment. And the last one for Andres, his mom had messaged us. Well, actually, we had reached out first and he's in a carrier. And so we asked them how it's going, how many hours is Andres wearing his rubber bands, how many times is he replacing them. So she answered those questions and she said that they needed more elastics. So we were working back and forth with her how to get those elastics. His sister is actually in treatment. So we let her know that we'll give them to them in a few days when they come to the sister's appointment on that Monday. So we're able to have close conversations with our patients and parents. And so this slide shows you just a snapshot of what the DentalMonitoring dashboard looks like in a specific patient, specifically related to oral hygiene compliance. So Mr. Noah here, you can see in the beginning of his treatment. So he started treatment in June. He had 5 reds in a row. So that means that he had a poor oral hygiene score 5 times in a row. And then after that, so he got messages, reminder messages after each of those through the AI, that he just needed to work a little bit better. And you can see that his oral hygiene has greatly improved through his time in treatment. And that was all those 5 poor oral hygiene scores was before we saw him for his next appointment. And so that dental monitoring and the AI technology and the automated messages were the ones to change his oral hygiene practices alone. And so then once we saw him at his next appointment, we were able to tell him, good job, you're doing a whole lot better. And so he's been doing really good with brushing better. And so the photos that you see here, the first photo was from March 15th, where he got a good score, which everything looks pretty nice there. But then a week later, you can see that there's plaque buildup in a few areas. And so the AI had alerted us. It says noticeable amount of dental plaque and food residue in upper right 2, upper right 6, and lower right 2. And so then you can see in the messages what message he got. So it says, good oral hygiene is important during orthodontic treatment. We encourage you to brush after every meal, including careful brushing along the gum line. So that was automatically sent to him because he got that poor score there. And so next, let's see. So with each, so overall with dental monitoring, you are able to set protocols, different protocols for different patients and different treatment. So like a blanket protocol. So for example, here it has the braces plus hygiene, or a liner and hygiene. We have a ton in my office. We have a ton of different protocols. So we have youth braces, which though we have, let's say, so we have youth braces and adult braces. So the difference between the two is the messages that are sent through text, the AI. With youth, we're a lot more heavy hitting on improving their oral hygiene, where we know for an adult, if they get poor oral hygiene score, we don't want to send a message every single time. We might be a little bit more hands-off since they're an adult, but for kiddos, we really want to get in there and remind them to brush better each and every time. You can also set it up. So common is like a Carrier appliance. So Carrier on top and lower lingual on bottom. That's one protocol we have. Carrier on top, clear liners on the bottom, or Carrier on top, retainer, an Essex on the bottom. So you can set up really anything you want as far as the protocols go. And so those protocols make sure that the AI technology is making sure that they're capturing the things that need to be captured. So for, let's say, Carrier on top and clear liner on bottom. So we're able to notice any broken appliance on top, of course, monitor oral hygiene. And then on the bottom, if we're monitoring the clear liners, we want to make sure that they're tracking well. We want to make sure that they don't have any attachments being lost. And we also want to make sure that the clear liners are fitting well. So for each new patient, for each new patient setup, if we don't have a protocol created already, we will create that. So really the sky's the limit as far as that goes. And so it just really helps cater your treatment to what dental monitoring is able to pick up. So you can do that as well as within each patient. If a specific protocol, if you don't want to monitor something specific, you can go in and change it for each patient individually as well. So there is a lot of customization that you can do. And so dental monitoring also has goals that you can set for, again, blanket patients. So braces in general, clear liners in general, or with each patient, within each patient, you can set different goals. So this is an example of a braces patient where we can start the goals for any of these any of these things that dental monitoring can track with their AI. So, of course, if you're doing elastics, you would want dental monitoring to catch once the patient achieves class 1 canine and class 1 molar. They can pick up the correction of midline, the correction of cross bites, of course, overbite and overjet, and passive arch wires. So if the patient becomes passive within their arch wires, if they don't have an appointment already scheduled, then you can give them a call to get the patient in, or let's say their appointment is in 4 weeks from now, but their arch wire is passive, you can bring them in earlier to help speed up their treatment. So like I mentioned before, we have the dental monitoring insights, and you can monitor a vast amount of things. So plaque, gingivitis, the arch wires being passive. And so this is just all the data. So you're able to really pick up on the trends in your office. So you can see if things are getting worse or getting better. This is specifically for braces youth in the last 30 days. Here you see the dental monitoring insights for plaque, and specifically you could look at which teeth are getting the most alerts on. So here we have the incisors, so upper and lower incisors, as well as, this is pretty cool, so distribution per scan number. So scan number 1 is in the office, and so you can see these patients have had the plaque poor oral hygiene scores in their 2nd week. And so that is kind of to be expected, where they're not used to brushing with their braces. And so they get that first poor score or the red alert. And so dental monitoring sends them a message about that. And so you can see that their oral hygiene greatly improved after that 2nd week. And then also we see them around week 10. And so after that, they improved, and again around week 20, 21, and so then it improved then. So you can see those trends that are happening. Here are all the different things that dental monitoring can pick up as far as bracket debonds, bracket still debonded, loss of O ties, arch wire disengagement. And so let's go into a bracket debonding. So again, looking at the trend. So in my office in the past 30 days, it looks like it was the lower left side, upper left side. We see that happened in week 2, so scan 2, which means that those braces had fallen off within the first week of treatment. And so that likely means that there was probably something that happened during the bond. So poor isolation, or possibly the patient was hitting on those braces. Again, in week 13, we see a bracket broken there. So that was after their 2nd appointment. So possibly if we bonded the 7s at their 2nd appointment, we see a jump there. So again, we're able to use this information to help the team figure out exactly what to improve upon, and how to decrease these emergencies that we're having. Here is arch wire disengagement. So again, we see, right after their appointments, that's more or less when it's happening. So possibly not cinching the wire, or if we're going back to the 7s, which with the wire, which we normally do at their 2nd appointment, if we're cutting the wire a little bit too short and it's easy to slip out. So again, we just have this data. I'm able to talk to the team about it to improve that and decrease those problems in the future. So moving on to my cases. So let's see this first case. So this is Miss Kinsey. She came in with her chief complaint was crowded teeth. They actually came in about a year before we got started. So we had a delay in treatment for about a year. You can see that she has moderate crowding to severe crowding on top, moderate crowding on the bottom. She had an anterior crossbite of her upper left 2. We've been watching one of the main reasons why we recommended a phase 1 for her is her upper right 3 was erupting a little bit more mesial into that 2, and from her original pano to the this pano, I saw it was getting a little bit worse, and so we recommended that we get in and do her phase 1 to correct that crossbite of the upper left 2, to improve the to create more space for the upper right 3. And so the treatment plan was for a phase 1 for about a year with Hyrax expander and partial braces on top and bottom. So you can see here, we put her on the monitoring plan of Braces Youth with the DM goals of correcting the crossbite. So we would get alerted when that crossbite was corrected, as well as when her arch wires become passive. So here is her dashboard. And you can see she did a pretty good job. She only had one. So the top line is any brackets broken or wire disengagements, any essentially emergency. So we only had one with her. And the second one where the toothbrushes is oral hygiene. So again, she had some reds in the beginning and things were, there was a lot more green towards the end. And let me go on to the expansion. So instead of having the patient come in to check their expansion, we're able to check the bite as well as measure the amount of expansion that we have with dental monitoring. So it does, it has taken away a few appointments for my patients. And so we can see here, this is just a snippet of where she was at with expansion. I was able to check her bite and let them know that they were okay with, they had finished the turn, so no more turns for her. She is good to go. And here is the before and after progress photo that every patient gets on their app, and it updates for every scan that they do. So it's pretty cool to see. So you can see here the before and after of just essentially it's within one appointment that we see these changes. And so at the patient's first appointment back, I pull this up and I show the patient and parent, you know, how much things have changed. And so for this patient, the mom was just thrilled, and she already saw it on her phone. She had noticed it, and she was just tickled that there was so much progress in such a short amount of time. And so with this here, this was her one and only emergency that she had. So we had an arch wire disengagement of upper left E. So you can see that that arch wire came out of that bracket. So we were notified at that scan. Luckily, the arch, those springs were still intact. So they hadn't fallen out. So we were able to let them know, hey, let's have you guys come in quickly to get everything re-engaged. So dental monitoring did message them immediately, saying it seems like a wire is partially engaged from Beckett. We'll contact you if an additional appointment is needed. And so we did. We called them, had them come in to fix that for them immediately. So here's a summary of her treatment. With dental monitoring, I feel like I had much more clinical control. I'm able to see the patient weekly through their scans to adjust as needed as far as the next time they came in. Also, we saved appointments for them and for the office, especially for them for the expansion checks. We were able to do that through dental monitoring alone and not have them come into the office. We handled her emergency in a timely manner. And particularly for them, the mom was wowed by the before and after video, which they're able to have through the app and be able to see it and show friends, and also improvement of hygiene over time. And for I have a second case here. So for Miss Mia, she came in again with a chief complaint of crowding. She's class 2. So we decided to start her with the Carrier or D2 distalizer and then transition over to braces. So with the plan, we put her first on the plan of Carrier with removable lower. And then once she was done with that, we switched her over to the braces youth protocol. We set goals for her. Once she achieved class 1 canine and molar, we would be alerted for that. So we were able to not have her come into the office to check on her the class 1 achievement. We were able to find that through dental monitoring. Also, we set the goals of normal overbite and passive arch wires. So this is her dental monitoring chart here. We can see, so the first half, that's where she was in the Carrier. So the track of that looks a little bit different than when she was in braces. But as you can see, similarly, her hygiene has improved over time. And she had a few times when she had emergencies, which we were able to capture. So with my Carrier patients, what we do is we just let them know once we bond it, we let them know, hey, the next time you're gonna see us in the office is when you're gonna get your braces on. And so we will be monitoring you weekly to see when you're done with this appliance and when we could get you in for braces. So it definitely minimizes the number of appointments that we need to see them within the office. So you see here that we were, so this was when, an example of when we reached out to the patient, how are you doing with your elastics? How many times a day are you changing them out? How many hours a day are you wearing them? So again, we're in constant communication with them. And as you could see in this photo, we are able to continuously monitor their improvement as far as their bite goes. So get them in when needed, when they're ready to get those braces on. So once she achieved class 1 molar and canine classification, we switched her over to braces. And about a week later, she does this scan and we see that she actually had a broken bracket and even a disengaged wire and an OCS had fallen off on the top. So dental monitoring automatically sent the message of, we notice that part of your braces appear to be broken. We'll contact you if an additional appointment is needed. So they alerted us. And of course, this is something that we needed to fix immediately. So we gave them a call, got her in, and then she was able to get in and out, and we wouldn't skip a beat with her treatment. So the summary for her treatment, she is still in treatment, so I don't have any final records for her, but she was in the D2 distalizer for 5.5 months, and we did not see her in the office for any of that. So we saw her in the beginning when placed, and we saw her once she was ready to get that off and get the braces on. So it saved us about 3 to 4 appointments versus her coming in for those check appointments. We also saved 3 appointments of her coming into the office during those initial level and aligning stages, and her emergencies were handled in a timely manner. As you saw, her hygiene had improved over time, and we were able to cut out those unnecessary in-office appointments. So this is my last case. So this is Dominic. He came in for a second opinion. He did not want jaw surgery, which is what another orthodontist had said he would needed. And also his dentist had called me personally and said they did not want any more extractions. So no extractions on the lower. The upper 4s had already been extracted, what I'm assuming was due to crowding. and possibly blocked out canines from being erupted. But as you can see, this patient has a class 3 tendency. And so, it's a pretty difficult case, especially to not do with extractions or with jaw surgery. But I let the parent and patient and dentist know I would give it my best. But these are one of the cases where I would say it's pretty difficult. And so generally, before dental monitoring, I would want them to come in a lot more frequently. With dental monitoring, that has changed things. So like I mentioned, patient had the upper fours extracted. He has a posterior crossbite on the right side, skeletal open bite, and did not want surgery, did not want extractions. And so my plan was to do, and he's 17 and a half, so almost close to being done with growth. So my treatment plan was for a MARP, face mask, and upper lower braces. But I let them know if surgery may be needed to get the result that we needed. So again, put him on braces youth. His goals were pretty much all of them because everything was out of place. So we set a lot of dental monitoring goals for him. So this is a snapshot of his dashboard. And as you can see in the middle through from October, November, December, he was not scanning. So once we saw him back in January, we asked him what was going on. And he said that the dental monitoring was on his mom's phone. So we asked if we could put it on his phone, and he let us. And so his scanning has been a lot better since then. And let's go here. So again, this is a MARP case. So I wanted to closely monitor him. I did a lot of MARPs in residency, but I hadn't done a ton in private practice. And so it always makes me a little bit nervous. So I wanted a close eye on him, and close eyes pre-dental monitoring were to have the patients come in very frequently, but with dental monitoring, I feel comfortable just looking at those scans. And so once he started turning, we can see that he started getting the gap in between. I was super excited. I sent him a message, yay for the gap in between your front teeth. Go ahead and start wearing that face mask. And I coached him a little bit on trying to get that palate a little bit cleaner. So you can see in the last photo on the right side where we got the complete expansion there. So again, that just makes me super happy to have that close monitoring, especially for those cases where you're it's a little bit out of your comfort zone, where it's a little bit more difficult than the average bread and butter case. And so you can see here that we got an alert of an archwire disengagement of lower left 7. Dental monitoring is very, they can see a lot of things that maybe I can't even see with the photos. And so the AI is very, very good in my opinion. And so they picked that up. They sent him a message. We went ahead and called Dominic to get him back in so that we didn't lose that lower left 7, so it wouldn't go out of place. And again, just, there's a lot going on here. There's the MARP, there's the face mask, there's opening space for those blocked out lower 5s. And so having that weekly scan gives me that peace of mind that I really need for these cases. So right here we see, oh, this was the last scan that he had done before I compiled this presentation, and he was biting more edge to edge, which is obviously scary in a class 3 case. But when I had seen him at his previous appointment, he was not edge to edge. He had a normal overbite and overjet. So I texted him through the app and I just said, do me a favor and make sure you bite down fully on your back teeth so I could get an accurate look at your bite. And so I actually saw him in the office this past week, and his bite, luckily, we had normal overbite overjet. So I just reminded him again at his appointment to go ahead and bite down on his back teeth. So again, more direct communication with the patient is really nice in those circumstances. So as far as the summary goes for him, he is not he is not finished with treatment, but in my opinion, this is a high difficulty case, but there's no need for those closer appointments that I was doing pre-dental monitoring, because I can see him every single week through dental monitoring. For as far as benefits and practice optimization goes, we saved him appointments with the expansion checks that I normally had done. We saved appointments during those initial leveling and aligning. We caught the emergency and handled it in a timely manner. And probably the best thing is no sleepless nights for myself. I'm sure many of you go home and think about those cases where you're really hoping things are going well and you just can't wait to see them for their next appointment, hoping for the best, hoping that things look really good. But with dental monitoring, you have that peace of mind. For his experience, improved oral hygiene over time. We cut out those extra appointments where, the parents are having to lug the kid back and forth, and also that direct communication. So this is the last slide. I'm sorry for keeping you guys long. So as far as any, anything that I can say to, as far as next steps for you guys that are considering dental monitoring, I would look at those current hurdles and problems that you have in your office. Make a list of those and see if dental monitoring would help with any of those. I am pretty certain that dental monitoring would be a huge help, a huge benefit in a lot of problems that orthodontists are facing nowadays, just like it helped in my office. But make a list, see what things dental monitoring can help you with, so that you can make the best decision for your practice, because I know that you have to weigh that versus, starting something else in your office, or, there's obviously pros and cons to everything, every decision that we make in our practice. You have to decide on what would be the best fit. Reach out to your local dental monitoring rep. Dental monitoring has them throughout the country. We have a great one in Northern California if you're there. And they could give you a lot of resources. They could hook you up with other doctors in your area or other areas that would be glad to speak with you about your experience. And then if dental monitoring is right for you, I would just commit 100%. I just went full force in. That's just my personality, is not to just have like 1 foot in and 1 foot out, but I really feel like I've had the most success because I just jumped in, I gave it my all, and I started it with every single patient. And I think that was really the best decision. I think it's had a huge benefit in not only clear aligner patients, but even braces patients, as I showed you guys today. And even beyond that, retainer checks, reavals, really anything. It's been a huge blessing to my office. And so just wanted to share my insight with you, my feedback from my experience. And so I hope you guys learned something today. And feel free, I know now is the question and answer, so feel free to ask any questions you have or reach out to me in the future. So I'm gonna stop sharing and give it back to dental monitoring.
Thank you so much for that fantastic presentation, Dr. Christensen. We do have a couple of questions to answer, but while we're doing that, I'm also going to display a QR code on the screen right now for a survey. We do encourage you to take this short survey at your convenience, preferably before you leave, and share your feedback with us, please. Also, let's see. If you do have any additional questions, please be sure to put those in the Q&A. Let me go ahead and read off your questions. The first question is, how much time is spent daily or weekly reviewing all of the clinical instructions and messages? And how often are you replying and having direct communication with the patients through the DM app?
All right, great question. I'm glad you asked that because I didn't touch upon that very well. So I did train 2 team members to be my dental monitoring people. One is a full-time team member, which she is an RDA, so she is in the chair day in and day out. And then in her free time, in her open time, she is the one jumping on dental monitoring, going through, she is in charge of all the clinical concerns. So if it's a bracket debond, she is making, I trained her to make those decisions on who needs to be seen, who to call right then and there, what problems that she is seeing that we got alerts to that I need to take an eye, have an eye on. So of course, any Hyrax checks, any like Carrier checks, bite correction checks, she is putting over where in my bucket, I call it. So I have a few patients there every once in a while, so I am looking at those. But she does the bulk of the work. And then she's also the one answering any messages. And so if we have a lull in the schedule, let's say if a patient didn't show up or we didn't have a patient for that 30 minutes, the other team members would be working on patients and she would be the one, she's kind of the floater. So any available time in the clinic, she's the one to be pulled away to work on dental monitoring. And I would say on average, so I have, I think almost 600 patients that are being monitored. And so she works anywhere from 20 minutes per day to maybe up to an hour. And then as far as me, I would say if I go on daily, maybe 20 minutes, if that, usually a lot less, and I usually don't go on every day. She would usually let me know if there's someone in my bucket to respond to, but usually there's very few patients that I have to look on and respond to. But she's the one messaging the patients back. So I would, you need a smart person to get your smartest person to help you out with it, train them well, and then that would decrease a lot that's on your plate. I also have a part-time team member. She's a pre-dent student, so she is very smart, and I love her. And she is also helping with dental monitoring, more of the late scans. So she is in charge of, there's a really great area in dental monitoring. Dental monitoring tracks late scans. So if they're within a week late, I don't worry about that. But if they're beyond a week late for their scan, my pre-dent student and part-time employee will go on and message those patients through dental monitoring. If it's been over 2 weeks, then she'll message them, she'll text them through through Ortho2 that we use, or give them a call. And so there's kind of a protocol that she follows to make sure that they jump back on board with that. And then she also goes on and handles any of the alerts that we have with poor oral hygiene. So she's the one to sift through those. And since dental monitoring gives those automatic replies, she does not have to do a lot of responses or text to the patient. But in those circumstances where she feels like it would be important for them to get an annotated photo, then she'll go ahead and do that. So takes very little of my time to do. But you just need a really good team member, or possibly two, and they'll divide and conquer and give you the patients that you need to see.
How much time per week does your DM coordinators spend dedicated to dental monitoring?
So, so per day, like I mentioned, about 20 minutes to an hour. I would estimate maybe about 2 hours a week. On Fridays, it's not a normal patient day, but she works Fridays, so she has some excess time on Fridays. Also, we have those what I call dental monitoring blocks, where we don't see patients during that time. So we have plenty of time for her to jump on. But if I had to guess, I would say about a good 2 hours per week. So make sure that the person that you choose, you give them that time to be successful with that, so that they're doing a good job with that.
Great, thank you. Do you think the angle of the buckle shot photos can prevent you to fully diagnose and monitor the bite correction, like in the Carrier case, or see the transverse correction properly in the RPE case? It seemed like the patient wasn't fully biting down to check the crossbite correction.
Yeah, so if there's any issues with so I'll actually start with dental monitoring did come up with a new scanning technique for the patients where now they have to pop certain bubbles. And so one of the bubbles is really far in the back to try to get them to go what we call ear to ear. So that just was implemented in my office about 2 weeks ago. So we're getting a lot better photos with those side shots. Before that, if I did have any questions or concerns about that class 1 correction, sometimes I would message the patient and ask them to retake it. You can send the patient an additional scan request. So I would do that. I would ask them to do it again and make sure that they go ear to ear. And so usually that next one is a lot better, or look at their last scan or wait for their next scan. So sometimes I use some multiple scans in order to determine if they're in fact class 1. AI can also help with that. They're able to help determine, like, so with their class 1 with their class 1 achievement, that also I look at what they say, and then I also use those photos with the crossbite correction. So posterior crossbite, I actually use, so I like to look at the roof of the mouth to see exactly, like, did we get 6 millimeters? Did we get 7 or 8? Whatever I was hoping for, as well as I actually don't use a lot of the side shots for that. I use more of the front so that I could see the buckle. And since the scope retracts the cheeks, I'm able to see if we had a posterior crossbite before, how many millimeters have we been corrected there. So I use a front shot for that. But more likely than not, with using a few different scans, I'm able to determine that, or just have the patient. I'm not I'm okay with them being overcorrected as well as far as a class 1. So if I'm not quite sure, I would even just look at, a few scans from that point to see, like, if we're a little bit overcorrected, that's even better for me. So I don't worry too much about that, but usually I feel like I'm able to determine that. And then once the patient comes in for their appliance out and braces on, luckily I haven't had to turn any patients away where I thought we were good, but we weren't. So I frequently will message them to retake it, or, like, let's say they are biting edge to edge, I could tell that they're not biting correctly. I'll just ask them to retake that scan for me so I could see it more appropriately.
Okay. Can you please talk about how you set timing for your goals in DM?
So as far as the goals go, so a lot of the goals you can set, like, let's say we have passive, one of my goals is passive arch wires. So the team knows that when they put in a new arch wire, they reset that, and we put it the end goal to be what their next appointment is supposed to be. So 10 weeks out. So we will get an alert either that they achieved that goal prior to that. So let's say it's 8 weeks in, and they achieved the goal of passive arch wire, then we're able to contact the patient if we have openings in our schedule to bring them back in earlier. If they get to the 10 weeks and that goal is not achieved, we would also get an alert saying the goal is not achieved by the time that you set. And so again, we usually just see the patient nonetheless at that 10 weeks so that we can either move up an arch wire or retie the wire. But we usually set the goal to where we would expect it to be corrected. So in, like, a class 1 type. So usually I say that we could get about 1 millimeter a month of correction. So if they are, if they're 5 millimeters class 2, I'll set the goal for 5 weeks to see if we achieve it within those 5 weeks, or if we haven't, I want to be alerted as well to see how close we are. So then I could reset that goal for a few more weeks out.
Thank you. Do you use dental monitoring during retention phase, and for how long?
Good question. So we have started using dental monitoring for the retention phase. So for those patients that were in dental monitoring during their active treatment, and I have a criteria if they were doing well with their scanning. So if they were, let's say, like 80%, good with scanning regularly, then at the end of their treatment, we do give the patient and parent the opportunity to continue with dental monitoring. And most times the patient and parent take us up on that, and they want to continue with the scanning instead of them coming in for their in-office retainer checks. So pre-dental monitoring, my retainer checks were after 2 months, then 5 months, and then another 5 months. So I would see them back 3 times during that year. And so now with dental monitoring and offering for their retention checks through dental monitoring, I set it for every 3 months. So they'll actually scan 4 times. So every 3 months they'll scan, and we have seen great, very accurate responses from dental monitoring. Of course, once you try something new, like I was a little worried about having patients in retention and possibly dental monitoring not picking up a ill-fitting retainer, but it does. And so we get alerted if the retainer isn't fully in. So we do a lot of thorough and Essex retainers. And so if it isn't fully seated, we will get an alert after their scan. So either like I'll look at the scan to see, do I think that they just didn't put it in well or enough? So I may ask them to redo the scan, trying to push it in all the way. And then so I'll see if that was true or not. Or if I could very well see that, yes, it is not fitting any longer, then we'll call the patient to have them come in. But we've been getting really good feedback with that, as well as really accurate diagnosis from dental monitoring and alerts. And so we have them scan every 3 months for that. And of course, we tell them at the beginning if it's not, if they're having any problems with it, if it's not fitting well, if it broke or was lost, please give us a call. We're obviously here for them. For our comprehensive cases, then they would just finish that dental monitoring after a year, and then we let them know, just give us a call if there's any issues with that. For our phase 1 cases, I will continue to have my patients scan every 3 months, bringing them in as I see fit for an additional pano if needed, or if I need to modify their retainer. And then once they have all of their adult teeth in, we would then have them come back for a phase 2 evaluation.
Okay. And last question, do you use dental monitoring for observation patients? If so, why? And do you charge a fee for that?
So our office has started offering dental monitoring to our observation patients. I think the fee that we give them is $99, where they would get the dental monitoring kit, and then they would be able to scan at home every 3 months. And we give them the option, so they don't have to do that. If they prefer to come for in-office visits, that's completely fine. If they would prefer to purchase the dental monitoring kit for $99, that would save them obviously time coming into the office. And so some of our patients have decided to do that. And so it's just an option that we give, and obviously it keeps them engaged. For their scanning, since we have them scan every 3 months, it keeps them a lot more engaged with our office versus my normal recall protocol is possibly Every either 6, 9, or 12 months, depending on the patient. But we have started offering that to patients if they wanted to go for it.
I'm not seeing any additional questions, so if not, we will go ahead and end the webinar. But before we do, don't forget to take this survey, pretty please. Scan the QR code from your phone and complete that survey. Give us your feedback, and we appreciate you joining, especially since we went over a little, but that was fantastic. Thank you, Dr. Christensen, for the wonderful webinar, and thank you everyone for joining, and I hope you all have a great weekend.
All right, thank you guys.